Good morning, everyone, and good morning, Mama Reese. For this morning, we are tasked to report about lymphoma. So before ko discuss about lymphoma, let's revisit the anatomy and physiology of our lymphatic system. So ang ato ang lymphatic system is a network of tissues and organs that help the body to get rid of toxins, wastes, and other unwanted materials. The primary function of the lymphatic system is to transport lymph, which is a fluid containing infection-fighting white blood cells throughout the body. So ang atong lymphatic system has four key functions, and these includes, number one, it is responsible for the maintenance of fluid levels in our body. So if ever na excess of fluid na makuha from the cells and tissues, ibalik siya sa bloodstream and then recirculated in the body. So number two, it is responsible for the absorption of fats from the digestive tract. So ang fluid nga nasa itong intestine, which contains fats and proteins, i-transport po na siya balik sa bloodstream. Third, it is responsible for the protection of our body against foreign invaders. So habang naman ang atong lymphatic system plays an important role in the production and release of our lymphocytes, which is ang atong mga immune cells. And lastly, it is responsible for the transportation and removal of waste products and abnormal cells from the lymph. So as you can see from the screen, these are the organs of our lymphatic system. So we have our tonsils, lymph nodes, thymus, bone marrow, and spleen. So mag-run through very light about yung mga specific organs. So first off, we have our lymph node. So si lymph node, siya ang lugar or storage area of our immune cells called the lymphocytes. And we all know that our lymphocytes are necessary for the development of humoral immunity and cell-mediated immunity. Ang ato apong lymph node is responsible for filtering the lymph nga mosulod through afferent lymphatic vessel and bugawa siya kay efferent lymphatic vessel. Next, we have our bone marrow. So our bone marrow is responsible for both the creation of cells, T cell and B cell respectively. Kaso lang si B cell muna siya ang mag-mature kay bone marrow, and then T cell will eventually go to our thymus gland kay dito po siya mag-mature. So next, we have our thymus. So ang iyaha pong function kay ga-produce siya sa hormone nga thymosin, and that it also functions sa pag-program sa atong certain lymphocytes so that they can carry out their protective role in the body. Next, we have our tonsils, which is also responsible for the protection of our digestive tract and the lungs from disease-causing agents that enters the mouth and nose. Next, we have our spleen. So si spleen provides a site of lymphocyte proliferation and immune surveillance and destroy worn out RBC and return some of their breakdown products to the liver. So yapong other function, it includes storing platelets and act as a blood reservoir. Next, we have our Peyer's patches and ato appendix. So both of them are in ideal position to capture and destroy bacteria, thereby preventing them from penetrating the intestinal wall. So na po ni sa lain-lain nga function, and bisan tuod nga appendix can be removed kung mag-appendicitis ang patient, lagi ni siya gina-play po an important role with regards to the removal of waste in the digestive system. So sa lymphoma na ta. So what is lymphoma? Lymphoma are neoplasms of cell of lymphoid origin. These tumors usually start in the lymph nodes but can involve lymphoid tissues in the spleen, GI tract, liver, or bone marrow. So kabalo man ta kanang mga organs are part of our lymphatic system. So ang lymphoma has two categories. We have the Hodgkin lymphoma and non-Hodgkin lymphoma. So first off, ato i-tackle kung unsa si Hodgkin lymphoma. So Hodgkin lymphoma is unicentric in origin and that it initiates in a single node. Ang kaning makita nato sa microscope ani or katong sa mga laboratory tests, specifically sa cell, makita nato ang malignant cell, which is Reed-Sternberg cell. It is a gigantic tumor cell that is morphologically unique and is thought to be immature lymphoid origin. So ang Hodgkin lymphoma is common in men than in women. It has a familiar pattern and na siya two peaks of incident, which is lahi og age. So ang first peak is 15 to 34 years old and second is after 60 years old. So what are the risk factors for Hodgkin lymphoma? So first we have the age. So people between the ages of 15 and 40 and people older than 55 are more likely to develop Hodgkin lymphoma. Gender. Men are slightly more likely to develop Hodgkin lymphoma than women. We also have family history, so very self-explanatory that this could be passed from generation to generation. And another risk factor is virus exposure. The Epstein-Barr virus causes infectious mononucleosis. So, bisan to, dili pa gini siya clearly explain kung unsay connection ni EBV sa ka-form or pagka-stimulate or trigger with regards to the formation of Hodgkin lymphoma, daghan mga studies nga gina-associate gid siya with EBV. So what are the signs and symptoms of Hodgkin lymphoma? So number one, we have a palest swelling of lymph nodes in the neck, underarm, or groin area that does not go away within a few weeks. So you have to remember nga ang Hodgkin lymphoma is sa neck, underarm, and groin area gina siya. As we go along with our discussion, ma-differentiate ninyo si Hodgkin and si non-Hodgkin with regards to the location kung aha mag-develop or mudako ang isa ka lymph node. Napoy unexplained fever, weight loss, night sweats, pruritus, fatigue, pain in the lymph nodes triggered by drinking alcohol. There is also shortness of breath, cough, or chest discomfort that may be caused if lymph nodes in the chest are affected. All organs are vulnerable to invasion by tumor cells. The symptoms result from compression of organs by the tumor. So since mudako man siya, so naagi mga organs nga makompress kay syempre as tumor grows, makompress gid siya. So first, we have the cough and pulmonary effusion if ang ato ang pulmonary system or our respiratory system is involved. We also have jaundice from hepatic involvement or bile duct obstruction. We also have abdominal pain from splenomegaly or retroperitoneal adenopathy. Splenomegaly is one of the signs and symptoms of Hodgkin lymphoma. We also have a bone pain from skeletal involvement. We also have the B symptoms. So kaning B symptoms, very important po ni siya murag na ni siya impact or na ni siya bearing when it comes to the prognosis of Hodgkin lymphoma. So first, we have fever but without chills. Number two, we have drenching sweats, particularly at night, which is also mentioned kaganina, and unintentional weight loss of more than 10% of body weight. With regards to the hematologic findings, na ay mild anemia, which is the most common hematologic finding. Ang leukocytes is sa katao nga na Hodgkin lymphoma may be elevated or decreased. And lastly, platelet count is typically normal unless the tumor has invaded the bone marrow, suppressing hematopoiesis. Hodgkin lymphoma's medical management. The general goal in the treatment of Hodgkin lymphoma is cure. Treatment of limited-stage Hodgkin lymphoma commonly involves a short course of 2 to 4 months of chemotherapy followed by radiation therapy to specific involved area. Combination chemotherapy, also known as ABVD, is often considered the standard treatment for more advanced stages, which is stages 3 and 4, and all stages with B symptoms. Chemotherapy is often successful in obtaining remission even when relapse occurs. Transplant is used for advanced or refractory disease. Revised treatment approaches are aimed at diminishing the risk of complications without sacrificing the potential for cure. So next, you have non-Hodgkin lymphoma. So what's the non-Hodgkin lymphoma? Non-Hodgkin lymphomas are heterogeneous groups of cancer cells that originate from the neoplastic growth of lymphoid tissue. So okay, lymphoid tissue man ang affected or ang place of origin, ang involved ani is ang ato ang B lymphocytes and atong T lymphocytes. So si B lymphocytes 95% and 5% si T lymphocytes. Ang difference ni non-Hodgkin o ni Hodgkin lymphoma is that sa non-Hodgkin lymphoma walay makita nga Reed-Sternberg cell. Kay Hodgkin lymphoma, lagi na siya makita. And then, ang lymph nodes from multiple sites may be infiltrated. So, sa ngalan nga multiple sites, dili lang sa neck, sa groin, and sa armpit makita ang enlargement of the lymph nodes, but to multiple sites of the body. So, what are the risk factors? First, we have age. So, magkatigulang ka, mas magkataas imong risk of developing NHL. So, accordingly, the most common subtypes occur most often in people in their 60s and 70s. Next, we have gender. Men are very slightly more likely to develop NHL than women. We also have bacterial infection and viruses. We also have immune deficiency disorders, autoimmune disorders, organ transplantation, previous cancer treatment. So, nga nung aning upat, isa ay makonsider man siya as risk factors. Tungod kay kung naaman lang galing ka any of these four, pasabot nanay alteration and kanang nanay effect sa imong immune system, it's because para aning sa cancer treatment, kabalo man tang kaning mga anti-neoplastic drugs, chemotherapeutic drugs, nani siya side effects sa ato ang immune system. And then we also have chemical exposure, which is exposure to pesticides, mga specific chemicals nga maka-affect pod sa ato ang immunity and increases the risk of NHL. Next, we have genetic factors. We also have vaccine. Kani sa vaccine, na po yung mga undergoing ang mga studies and researches to prove the connection of vaccination and developing NHL. So we also have breast implants, exposure to ionizing radiation, because radiation can affect our immune system gyapon. Same ra gyapon na siya sa effects sa radiation therapy, chemotherapy, and other types of therapy for cancer. So what are the signs and symptoms? So in general symptoms, enlarged lymph nodes in the abdomen, groin, neck, and underarms. There is also splenomegaly or hepatomegaly, fever that cannot be explained by an infection or other illness, weight loss with no known cause, sweating and chills, and fatigue. So as you can see sa atong screen karon, mo po na yung mga examples of symptoms related to a specific tumor location. So di na ako sila tagsa-tagsaon, but for example, is a tumor in the abdomen can cause a stretched belly or pain in the back or the abdomen tungod kay katong pagdako sa tumor, posible nga naka-block na to og circulation or na mga blood vessels nga napiit and so on. So for the medical management, treatment is determined by the classification of disease, the stage of disease, prior treatment if naa, and the patient's ability to tolerate therapy. So when we say tolerate therapy, unsa may pasabot? So tolerance to therapy is largely dictated by renal, hepatic, and cardiac function. So mga important kini sila nga things to consider. And we also have katong functional status, age sa patient, and so on. So if the disease is not aggressive and is localized, radiation alone may be the treatment of choice. Pero para sa mga aggressive type of NHL, aggressive combination of chemotherapeutic agents ang gamiton. So natin yung natawag ang combination of the monoclonal antibody rituximab with conventional chemotherapy is the standard treatment for common lymphomas. And when our central nervous system is involved, mag-add or use in addition to systemic chemotherapy is cranial radiation and intrathecal chemotherapy. Hodgkin lymphoma nursing management. Number 1, we have to educate client that Hodgkin lymphoma is one of the curable types of cancer with the help of appropriate treatment regimen. Number 2, encourage client to reduce other factors that increase the risk of developing second cancers, such as use of tobacco and alcohol, and exposure to environmental carcinogens and excessive sunlight. Number 3, we have to promote good hand washing procedures by staff and visitors and place in reverse isolation as indicated. So, as we all know, cancer patients can undergo chemotherapy and radiation therapy, and kabalo po ta nga ang chemotherapy is the most common cause of weakened immune system in patients with cancer. So taas ni sila og risk for infection. So as nurses, we have to do things and we have to manage this nga atong i-prevent nga mag-infection sila. So fourth, we have to educate client about screening for late effects of treatment, kaya kani mga treatment modalities for them have their own side effects. Number 4, provide education about relevant self-care strategies and disease management. Number 5, monitor temperature kato kaganina gani no para makabalot nga uy murag taas lagi ang temperature, and we have to check the WBC as well kay para makabalot kung infection gid siya. And then we have to encourage fluid because ang fluid pud nato no kay ga-enhance pud na siya sa activities ato immune system. And lastly, reposition frequently, keep linens dry and wrinkle-free. Kaya gani sila, prone po ni sila sa mga samad-samad. So, bisag samad lang ang scratch, tungkol kay immunocompromised sila, dugig na sila maulian, or pwede po na siya nga mahimong rason na magka-infection na noon sila. And then we also have nursing management for non-Hodgkin lymphoma. So first, we have to educate client about ways to minimize the risk of infection, to recognize signs of a possible infection, and to contact their healthcare provider if such signs develop. Number 2, additional complications depend on the location of the lymphoma. Therefore, it is our responsibility as nurses to know the tumor location so that ma-focus nato dito ang atong assessment. For example, if ang tumor dito nagtubo sa lungs dapit, so there is a possibility na magka-airway obstruction ang ato ang client. So, kailangan na ito mahibalaan kung ahagid located ang tumor para dito ta maka-focus atong assessment and maka-intervene ta as soon as possible. We also have to promote good hand washing procedures by staff and visitors. Ito ang mentioned ka ganina kasi magyapon ka Hodgkin. And then fourth, we have to educate client about screening for late effects of treatment, provide education about relevant self-care strategies and disease management, monitor temperature, encourage fluids and reposition frequently, keep linens dry and wrinkle-free. So in summary, Monisha, know what is the difference between Hodgkin lymphoma and non-Hodgkin lymphoma? So both Hodgkin and non-Hodgkin lymphomas are a malignancy of a family of white blood cells known as lymphocytes, which helps the body fight off infection and other diseases. Hodgkin lymphoma is marked by the Reed-Sternberg cell, and si non-Hodgkin lymphoma is wala. Di ni siya gakakita under the microscope. So incidence, both diseases are relatively rare, but non-Hodgkin lymphoma is more common in the US. So accordingly, 70,000 new cases diagnosed each year sa US for non-Hodgkin lymphoma and 8,000 new cases for Hodgkin lymphoma. So as we can see, no, grabe yun. Dako kay ang difference. So mas common good si non-Hodgkin lymphoma than Hodgkin lymphoma. The median age of patients with a non-Hodgkin lymphoma is 60, but it occurs in all age group. Hodgkin lymphoma, on the other hand, most often occurs in people ages 15 to 24 and people 60 years old and above. Kaya kani siya kato kung gimension ka kanina na siya duha ka peak of incidence. For symptoms, ang Hodgkin lymphoma are more likely to arise in the neck, underarms, or chest, while non-Hodgkin lymphoma, on the other hand, can arise in lymph nodes throughout the body. Progression. Hodgkin lymphoma tends to progress in an orderly fashion, moving from one group of lymph nodes to the next, and is often diagnosed before it reaches an advanced stage. But non-Hodgkin lymphoma, on the other hand, are diagnosed at a more advanced stage. So for the treatment, it depends on the type of disease, aggressiveness of disease location, and patient's age and general health. Hodgkin lymphoma is considered one of the most treatable cancers, with more than 90% of patients surviving more than 5 years. So with regards to the diagnosis of Hodgkin lymphoma, we have physical examination, we have a biopsy, we have imaging tests such as PET scan, MRI, CT scan, and other imaging tests. We also have a blood test kaya para makita nato kung naa ba si Reed-Sternberg cell or wala. And other purpose of blood test may be associated with the lymphocyte count. And we also have tests of heart. So ngano kaha nga appeal ang test of heart? So kung gimension ka ganina, isa sa ato i-consider with regards to offering or having the therapy for the client is yung tolerance sa therapy. And one of the things na dapat natin i-consider is ang heart function or ang cardiac function sa patient. So with regards to the concept map, akong ihatag kay Aiza ang higayon. So that will be all. Thank you.
It begins in infections, fighting cells of immune system, and chance and draw out of control. So predisposing factors is like age, gender, family history, exposure to chemicals such as benzene, radiation exposure such as using high dose of radiation, weak immune system, and autoimmune diseases, and the race. And precipitating factors is exposed to chemicals such as benzene, radiation exposure such as using high dose of radiation, weak immune system, and autoimmune disease. So lymphoma has the two types. You have Hodgkin and non-Hodgkin. So non-Hodgkin is associated with a pain, it's very contagious, and a disease of the young age. Hodgkin has two types of classification. We have classic Hodgkin and nodular lymphocyte predominance. Classic has nodular sclerosis, lymphocyte-rich, mixed cellularity, lymphocyte depleted. Nodular sclerosis is more common in women and with associated with shortness of breath and breathing and difficulty of breathing. So Hodgkin is positive for Reed-Sternberg cell during the test, and it can lead to lymphadenopathies because it starts in cervical lymph nodes that can cause cervical lymphadenopathy. Then trying to treat Hodgkin is using the high dose of radiation. It can lead to non-Hodgkin lymphoma. So non-Hodgkin lymphoma has associated with some signs and symptoms such as enlarged lymph nodes and enlarged spleen, pains, night sweats, and other symptoms. So non-Hodgkin is extranodal. It is a painless. So non-Hodgkin has two types of cell. We have B cell and T cell. B cell is the more common in non-Hodgkin. As B cell has the two subtypes. We have indolent and aggressive. Indolent means lower grade. So in indolent, you have follicular, marginal zone, and CLL and SLL. So marginal zone is considered is a B cell lymphoma. It's because margin is in a cortex, and the cortex has a V cell lymphoma. Therefore, margin zone has the V cell lymphoma. See, CLL or chronic lymphocytic leukemia is accumulated with lymphocytes, and SLL is a small lymphocytic lymphoma as nodular mass. So with the aggressive, we have diffuse large B cell, Burkitt's, and mantle. So diffuse large B cell, this time they use some test or a process that is a staging to find where the cancer is spreading in our body. Then with that, they use imaging tests, physical exams, bone marrow biopsy, and imaging test to they know how to treat cancer. So we have Burkitt's. Mantle is also a B cell lymphoma. Then cancer cells down into the bloodstream. Then other lymphoma secretes IgM and gamma globulinemia. IgM is monoclonal gamma globulin that can cause hyperviscosity in the blood, or syndrome. It can cause syndrome that down to immune cytopenia. Then gamma globulinemia means absent of monoclonal gamma globulin in the blood that can lead to infection. So with the other lymphoma secretes, we have compression. This time compression is considered like superior vena cava syndrome and obstruction, airway obstruction that can lead to ascites or a spinal syndrome. Then with the Epstein-Barr virus, it can lead to Hodgkin or non-Hodgkin. With this virus, it engages proliferation into nodules. It can lead to the progression. It can lead to cancer. So with the abnormal lab values, with abnormal result labs of non-Hodgkin, we have is pancytopenia and hyperuricemia. Pancytopenia is due to syndrome of bone marrow infiltration. Hyperuricemia is a cell tumor that's part of tumor lysis syndrome that can cause increased potassium, increased phosphate, increased uric acid, and decreased calcium. It's because phosphate is precipitate calcium by binding with it, leaving the less free calcium in the plasma. So for cancer cells in the bloodstream down to the bloodstream can lead to infection, and it can lead to cancer.